Hi, everyone. This is Dr. Krista Kim.
And Dr. Michael Kim.
Although I am Dr. Krista Burris, yes. I go by both names, but Dr. Krista Burris and Dr. Michael Kim from Coachella Valley Direct Primary Care. And we're here today on May 19th to talk about the state of coronavirus in the year 2021 in the Coachella Valley.
Yep. So how are you doing today? I know we skipped last week's show. We apologize for that, but our kids had swimming meets that we couldn't. It conflicted with the schedule. So
yeah, I'm doing good. I feel like we're heading straight into summer now, full blast here in the Coachella Valley, and so I'm sort of shifting gears mentally into my summer mode, where I start to think about summer activities for the family. And this year we get to figure out how the new changes in state mandates and the falling rates and the vaccination rates, how that's all going to sort of come together to help us plan our activities for the summer.
Yeah, it feels like still there's a lot. I mean, usually at this time in May, a lot of our snowbirds have left already, but it feels like a lot of people are still here.
Yeah, I think there's sort of a mixture of people who never came for the winter and people who decided to use this time to move here permanently. I have seen some people leaving, but it does feel like every year we get more of a year-round community, which is also nice.
Yep. So do you want to dive into the numbers?
Sure.
Or I don't know what you've...
Sure. What I've prepared today, I'm going to quickly run through the numbers, just sort of from a 10,000-foot view. They're basically the same as last week. So if we put the first slide up, what you'll see is that the daily epidemiology, this is for the 17th, I believe, shows 60 new cases and -1 deaths. So what does that mean?
Whoa, we brought something back to life?
Yeah. What does that mean? That basically means there were no new deaths and that they corrected the data to move one of the deaths for some reason. Either they moved the date that it was attributed to, or they decided that it didn't qualify as a COVID death. There are a lot of reasons why the data is constantly being amended. And one of the things that we've grown used to in the modern era is having just immediate data available. And the reality is that often it takes time for data to be cleaned up. And sometimes people see data change and they're like, hey, we can't trust it. Well, actually, if you see data change, normally what that means is additional numbers have come in. They've had time to sort out duplicate reports. I mean, there are all sorts of things that happen to data over time. And so this is not surprising. It's just that we're finally down to a range where when it happens, it's more noticeable. And in this case, we have a negative death number. But if you look down, we only have 54 patients in the hospital in the county. That's really good news.
So for people like me, what she said is, like, if the numbers are like 200 and next week they're like, oh, we miscounted, they would report 199 and we'd never know the difference. Right. But because we're in the single digits and it infects 0, we notice because it's now -1. So
okay, let's go down to the very bottom where we're looking at our positivity rate. And we've seen both in the county's numbers and in our numbers what I would call a pretty stable mid-ones. Both for the weekly county report to the state and for our local numbers, they've been a slight uptick up to like the 1.6, 1.7 mark. This is not enough of a change or a trend over time to be concerned. In my mind, these are basically the same numbers, But it is good to follow this over time, which is what we do, to make sure they don't continue that slow drift upward. But for now, it's pretty stable. And if you remember from our previous talks, our positivity rate qualifies us for the yellow zone, but our cases per 100,000 do not. And those are basically in the mid twos, and we needed those to get under 2 to go to the yellow zone. So it doesn't look like we are going to transition to the yellow zone prior to the color system being phased out on June 15th. Thank you. So it looks like we're probably going to just stay in orange until that date, and at which point in time the tiers go away, and basically we go back to sort of general recommendations, which probably will be altered and changed multiple times. So stay tuned, and we'll help interpret them as they come out. So let's talk a little bit about, the big news this week in the COVID.
Our girls made DEL champion?
Yeah.
That's not the
okay,
big
no.
news.
Okay. It's the CDC's new mask guidance. And one of the things that I think is kind of, one of those things we've learned through this year is that the CDC does not make policy or rules. The CDC makes recommendations, and then local public health agencies and governments make policies and rules and laws and mandates, etc. So I think that's important for people to understand, because your local agency or city or state or county may take those recommendations and use them in a different way and apply the specific local setting to them. So, for instance, if you happen to be in an area of the country that was experiencing a higher transmission rate, you may not see a mask mandate get lifted, even with the CDC's advice. Alternatively, we can talk a little bit about California, because we have the lowest transmission rate in the country, and we've chosen to keep our indoor mask mandate in place until June 15th. So let's talk a little bit about that. Let's unpack it a bit. What are your thoughts?
Well, why don't you go first and kind of give a synopsis of the CDC guidelines?
So the CDC's new guidelines basically broke down into vaccinated people don't have to wear their masks anymore unless they're indoors in a crowded environment like a concert or a sporting event, potentially even like church if there's lots of people jammed together. So their guidelines basically said, if you're vaccinated, take your mask off unless you're in these very specific high-risk situations. And if you're unvaccinated, you got to leave your mask on all the time. Basically, they said indoors all the time and outside if you're around other people. So what has happened basically, when they make the recommendation, which is based on science, and they're like, yes, this is what the numbers are telling us, that it's not a risk if you're vaccinated, so go ahead and take your mask off. The problem is when you roll that into the real world, you can't tell who's vaccinated and not vaccinated just by looking at someone. And it cannot be put on businesses to figure that out. So when you roll it into the real world, it's not so easy to just say, your choice. If you're vaccinated, leave your mask on and expect that. If you're unvaccinated, and expect everyone who's unvaccinated to do that, especially when we know there's been a slice of our population who have not been wearing masks even when it is recommended.
Right. Well, part of the problem is they also threw some caveats in like public transportation and airplanes, and so, well, why is that? If so I think there's more, and I understand there's more to it because with public transportation, there's other departments of the government and states involved, and so they're trying to not make blanket statements, but it does get confusing. So
in reality, what I think is going to happen or has already happened is when you take a mandate away, when you say you no longer have to wear masks indoors, everybody takes their masks off. And we know that in some areas, like 75% of the population hasn't even gotten their first shot. And that means that everyone who's not vaccinated has just become at much higher risk at a time when we know there are new variants circulating in the US, including the variant from India. So to me, this is a risk to the United States that is not the same for every place. If you have low transmission rates and high vaccination rates in your community, your risk of taking a mask off is much lower than if you're in a community with higher transmission rates and very low vaccination rates. Having said that, if you're living in a community where there's very low vaccination rates and very high transmission and very low mask acceptance, there's going to be a lot of social and peer pressure not to put a mask on. And so those people are at higher risk. And that's something that, thankfully it's not my job to try to help, but I do think we need some sort of more comprehensive outreach into these communities to help protect them. Because right now what we're doing is missing large chunks of our population.
Right. And so it is a very complicated, because when you give more freedom to some groups, that means some groups are not getting as much freedom. And the guidelines and the science are true, but it doesn't mean it's reality, right? So studies and science are these rigid tests where we hold all these parameters, and then we can say, well, if these parameters hold true in the real world, then we can make these state conclusions. But there was no study that said, well, we tested everyone who was vaccinated and who was unvaccinated, and we didn't know who had it or who didn't, and we went out in the real world and then we gathered the data. It was no, they looked at all the people who are vaccinated and they said, okay, let's see what happens to them in these controlled areas in terms of, they're not following them everywhere.
Well, no, but I mean, they are taking matched people in similar situations, and the ones that were vaccinated didn't get sick. And so they basically said, okay, they're in similar situations, they're pretty safe. The question is really, can we keep the momentum with the vaccination program to not go backwards and have another surge this summer?
Well, so my point was not that wasn't the true science and the reality, but the reality is, like you said, everyone is not going to follow that.
Right.
Just like we used to say, don't smoke, and people would smoke everywhere, and that's why now there are federal regulations that you can't smoke near certain buildings in a certain area. You can't smoke in hospitals and yada yada yada, is because as a whole we can't follow those guidelines. And so same with this is. Reality is, I would have wished they would have said, if we all follow these rules, then it is safe or safer. But we understand that that's probably not going to happen. So I would have, rather than put another carrot out there, and we talked about this, is if your area can get to a certain percentage of vaccination, then these rules should apply. And if you're not, then everyone still needs to follow the previous rules, because then that kind of makes it, okay, well, does the community want to get to that vaccination?
I just think in the way we have our system, the CDC puts out this guideline, and it's on the local governments to put those carrots out. and to say, hey, we want to take advantage of this data, which says we can take our masks off, but we know that we can't tell the difference. So we're going to wait until our population gets 70%, and then everybody gets to take their masks off. And it's always on the local government to make that call. And in some places, that's just not politically palatable. And so they will never be likely to do that. So in my mind, I don't know what the right thing is, because the CDC basically can't come out and say you have to do it this way.
Well, they could have recommended.
Yeah.
They could have said, we know what's going to happen in reality. So this is, the splitting of the two sides is, if you can get to a certain percentage, right? We're not talking about the panacea of herd immunity, but a reasonable vaccination status. Then I think it would have been better, because right now it's left to everyone, like you said. And in June 15th, magically our tier system is going to go away, because what has changed? Nothing in terms of the pandemic. And it is good that we have the lowest rate. But my fear is, as June 15th comes here, and the June 15th, what came sooner in a lot of places, because right now they're just saying there's no more mandates, we're going to see the bumps. And we're seeing the 0.1 bumps here because our rate is so low. But I think we're going to see a bump. And then when winter comes, we're going to see another bump. And so I don't think we're ever going to get back to where we were before, but we're going to see the bumps. And like you said, there's going to be different recommendations coming out, because things are going to get a little dicey again.
I honestly think that part of their calculus was getting us past Memorial Day weekend before they loosened it up. Because last summer, that's what really drove our summer surge, was the Memorial Day sort of bars and like everyone crowding into backyards and parties. And so my thinking is that's why they chose a date that was sort of mid-June, to see if we could kind of like temper that potential summer bump a bit, plus buy us another month to finish up the second shots on a lot of people, and see if we can get our 12 to 15-year-olds vaccinated. I really felt like they just wanted to buy a couple more weeks to make some progress, to solidify the control over the transmission. And I honestly, as a public health person, thinks that's super smart. I think the worst thing we could have done was immediately open back up completely when the CDC put that guideline out, because right before our holiday, before we'd had a chance to vaccinate our teenagers, I mean, I'm hopeful that this will save us from what's going to happen in some other areas of the country, which, I think people think, oh, it's over, but it's not. We could still see another 50,000 people die. I mean, 50,000 people, that's a lot. So I just want people to remember, it's not just old and sick people who have problems with COVID. Like, I know that's been driven home so much that people think if I'm not sick or I'm not old, I'm not at risk. But that's not true. We still see like a 3% mortality rate in people in their 60s. That's not that old. And also we see problems with the long-term COVID in young, healthy people having long-term problems. So this is a disease that we want to minimize that transmission as much as we can, even in our young, healthy people.
Yeah, so I think we need to get on to our next show, but I think this just summarize everything. The CDC has come out with these new recommendations, which are really positive, and people who are vaccinated really, it is shown that the vaccines are so good you don't have to essentially wear your mask. There's some places, whether it's political or because the risk gets a little higher, but for the most part, you don't have to wear your mask.
No, I think wearing them in super crowded, high risk situations and public transport, big concerts, that's science. That's not political. Yeah.
I don't think certain
I disagree.
transportations, right?
Transportation.
So transportation, if there's 3 people on the bus versus 100, so that, I mean, that's
Yeah.
the problem. I mean, we can go round and round, but I get why they have to do that. If you're unvaccinated, we ask you to continue to follow the social distancing, only because people like, our son who's 10 and he's not immunocompromised, but they're immunocompromised people out there, and people who are cancer and all these things can't get vaccinated. And so
if they do, they may not be well protected because their immune system just isn't as good.
Right. And so they can't benefit from that. And so we want to protect them from the virus. And the way we do that is either we get vaccinated or we follow the social distancing and the guidelines that public health knows, so that we can prevent those vulnerable people from ever getting COVID, even if it's a small percentage. So we will be back next Wednesday. And we will, if you can, join us on our next show, where we will talk about your health. At
3:30, we're going to be back.
No, it's 3:15.
3:30.
Sorry.